I think the Finance Committee bill is a solid beginning. It is paid for. In fact, it reduces the deficit over 10 years by $81 billion. It reduces deficits in the next 10 years as well by $650 billion to $1.3 trillion, according to the Congressional Budget Office, all the while expanding coverage and clearly improving quality, because there are major incentives here to improving the health care delivery system in this country, to promote wellness, and to reform the insurance market, to prevent people from being denied coverage because of pre-existing coverage, or from being dropped from coverage even after they've been paying premiums when they get sick. So very important market reforms, insurance reforms, paid for, and in fact reduces the deficit according to the Congressional Budget Office. One of the things that I think is most important is that most analysis shows this will reduce premiums that people are paying. If the number one thing I heard across North Dakota when I had 26 healthcare meetings was that premium growth is putting enormous pressure on families, on businesses, and on the government itself. And so one of the key tests here is cutting premiums, reducing the cost to the people who are buying these insurance policies. Yes, I have proposed a number of options that I think would be helpful in terms of further reducing costs, further reducing premiums. I hope those proposals are considered as we go forward. Many of the things that I proposed have been adopted that will help control costs, that will help reduce premiums, but there are more things that we could do here to make it more affordable. Well, it's going to be a great challenge to bring together the Health Committee bill and the Finance Committee bill. I think the Finance Committee bill, because it is the only one that is paid for, that reduces the deficit, and in fact bends the cost curve in the second 10 years, reduces deficits very substantially in the second 10 years, that the Finance Committee bill has the greatest likelihood of advancing intact. Certainly, the public option will continue to be debated. I think it's important to understand that public option tied to Medicare levels of reimbursement would be a real problem for North Dakota, because we have the second lowest level of Medicare reimbursement in the country. So public option tied to Medicare levels of reimbursement presents a real challenge for our hospitals, for our doctors, and for the medical system itself. Well, the hospital administrators have said very clearly, if you have public option tied to Medicare levels of reimbursement, that would create real hardship in North Dakota for the hospitals and for the entire healthcare system. And I think it's very important for people to understand that what we're talking about here is being strongly advocated by my colleagues from California, from New York. They benefit. It's important for people at home to know. Those states benefit because they have high levels of Medicare reimbursement. So certainly they want to tie public option to Medicare levels of reimbursement. So does Florida. For example, in Miami, they get 3 times as much for their Medicare patients as we get. 3 times as much. Of course they want to tie public option to Medicare levels of reimbursement. But that's not in North Dakota's interest. Yeah, there's a reason why these formulas exist as they do. It is because the House of Representatives is based on population. The high population states get the high levels of Medicare reimbursement. Those states are the ones most actively pushing for public option tied to Medicare levels of reimbursement. That is in their interest. That is in their state's interest. That's in their constituents' interest. It is not in the interest of the state of North Dakota, of the hospitals of North Dakota, of the people of North Dakota. Yes, the cooperative plan that I offered early on as a potential compromise to be something that would provide heavy, tough competition for the for-profit insurance industry, but would not be controlled by the government. That's the reason I advanced the cooperative plan. It is in this legislation, and I call it the public interest option because co-ops are controlled by their members. You couldn't have a more direct public interest than entities that are controlled by their own members. Well, facts really matter. That's what I would say to them. Clearly, cooperatives are not run by the government. cooperatives are run by their members. In North Dakota, we all understand how cooperatives operate, and I must say cooperatives are functioning in every state in the nation, have been for nearly 100 years. So we know how cooperatives function. They've been a very successful business model in many different lines of activity in this country, including healthcare. So I want to emphasize, cooperatives are run by their membership. They are not run by the government.